NACOSCE STARMED Sleep Problems by Zahra Samak. Key OSCE skills for sleep problems. 1. Focused history taking, identifying type and duration of sleep issue. 2. Effective communication, using layman's terms for understanding sleep difficulties. 3. Physical examinations, comprehensive approach to identify contributing factors. 4. Differential diagnosis, prioritize based on history and exam findings. Step 1. History taking. Chief complaint. Ask open-ended questions. What brings you in today? Clarify specifics. How would you describe your sleep problems? Onset, course, and duration. When did the problem start? Is it constant or intermittent? Any recent changes in lifestyle, routine, or stress? Timing. Ask about the timing of the symptoms. Example, difficulty falling asleep, waking up in the middle of the night. Is the issue happening constantly or just at certain times? Step 2. Investigate specific symptoms, sleep patterns, duration of sleep. How many hours do you usually sleep each night? And sleep onset. How long does it take you to fall asleep? Wakefulness. Do you wake up during the night? How often? And the quality of sleep. Do you feel rested when you wake up? Do you experience nightmares or disturbed sleep? Daytime function. Do you feel excessively tired or sleepy during the day? Impact on daily activities or work. Evaluate associated symptoms, snoring and apnea. Do you or anyone else notice that you snore at night? Do you ever wake up gasping for breath? Pain or discomfort. Do you have any pain or discomfort while trying to sleep? Ask about restlessness or need to change positions frequently. Mental health factors. Ask about anxiety, stress, depressive symptoms. Has stress or anxiety been affecting your sleep? Have you been feeling down or anxious lately? Substance use. Do you consume caffeine, alcohol, or any medication before bedtime? Are you using any sedatives, sleep aids, or recreational drugs? Assess for systematic and red flags. Constitutional symptoms. Ask about fever, weight loss, or loss of appetite to rule out underlying illness. Have you had any unexplained weight loss or fatigue? Sleep apnea, risk factors. Ask about obesity, age, or family history of sleep apnea. Do you have any history of high blood pressures or heart disease? Neurological symptoms. Do you have any headaches or dizziness or difficulty in concentrating during the day? And physical examination, general observation. Assess the patient's overall appearance. Look for signs of fatigue, excessive sleepiness, or distress. Vital sign. Check blood pressure for sleep apnea and hypertension, heart rate, and respiratory rate. Head and neck exam will be look for signs of obstructive sleep apnea, enlarged tonsil, adenoid, or large neck circumference. Examine the oropharynx and nose for obstruction. Cardiopulmonary exam, listen for any abnormal lung or heart sound, especially in patients with suspected sleep apnea. Neurological exam, assess for any signs of neurological issues, example narcolepsy or other CNS-related sleep disorders. Differential diagnosis of primary sleep disorder, insomnia, difficulty falling or staying asleep, sleep apnea, snoring, choking, and daytime sleepiness, narcolepsy, sudden onset of daytime sleepiness and cataplexy, restless leg syndrome, uncomfortable sensation in the legs, preventing sleep. Secondary causes, depression, anxiety, sleep disturbance due to mood disorders, Pain conditions, chronic pain, arthritis affecting the sleep. Medication, substance use, sleep issues due to caffeine, alcohol, or other drugs. Investigations and workup. Polysomnography, sleep study, essential for diagnosis, sleep apnea and other sleep disorders. Actography, wrist-worn monitor to assess sleep patterns over a period. Epworth sleepiness scale, a questionnaire to quantify daytime sleepiness. A blood test check for thyroid dysfunction, anemia, metabolic causes. Urine drug screening for substance use or medication affecting sleep. Management. Lifestyle modification, sleep hygiene education, maintain a constant sleep schedule, limit screen time before bed, create a calming sleep environment, avoid caffeine, alcohol, and heavy meal before bedtime. Cognitive behavioral therapy for insomnia, first-line treatment for chronic insomnia. Medication, sleep aids, melatonin for short-term use only, and consider treatment for underlying conditions, antidepressants for depressions, CPAP for sleep apnea. Refer for further investigation, sleep study, psychiatry, or pain management. And mnemonic for sleep disorder. Sleep, stimuli, stress, and anxiety, lifestyle factor, caffeine, alcohol, environment, room, conditions and light, exercise, impact of exercise on sleep, pain or discomfort affecting sleep quality. Sleepy for snoring, lethargy, and excessive daytime sleepiness. Epworth sleepiness scale, problem with concentration and yawning. And conclusion, remember, sleep problems are common but can have a serious underlying causes. Proper history taking, physical examination, investigations are key for accurate diagnosis and management. Good luck with your NACOSCE preparations.